Well, first of all, I'm honored to be here today at this mini symposium on liver-directed therapies for hepatocellular carcinoma. As part of session 1, I'm supposed to talk about eligibility and endpoints, but for the sake of time and for more of a patient's perspective, I'm going to focus primarily on eligibility. Before I jump into the topic of eligibility, I think we need to remember that 85% of patients with cancer are diagnosed and treated in a community setting, with only 3% enrolled onto clinical trials. And this year, NCI estimates there will be over 1.7 million newly diagnosed cases of cancer in the U.S., which means we're looking at over 1.4 million newly diagnosed cancer patients that will be treated in a community setting. So we cannot expect general oncologists to keep track of all the new drugs and clinical trials for every cancer. That's unrealistic. So one of the things we just have to do from the get-go is increase awareness among patients and caregivers at the community setting. So now I'm going to focus on patients who are aware of clinical trials. And for the next 3 to 4 slides, I want you to humor me, and I'm going to play the role of an HCC patient. I've been diagnosed with advanced disease, and I am a very savvy HCC patient. So I have heard of clinical trials, and I know about clinicaltrials.gov. So I go to clinicaltrials.gov. And I am so savvy that I know the differences between the different phases. So I want a phase 2 or 3 trial. And I even know what the word interventional means. So as of September 20th, I put in all my criteria, and there are 94 interventional phase 2 or 3 clinical trials that are enrolling by invitation, recruiting, and or active for adult HCC patients. Now, as a patient, I don't care who the funder is, so this includes all funder types. And what I'm thinking when I see the number 94 is, wow, that's 94 chances of survival. And I'm also thinking, oh my God, how am I going to get through 94 of these studies? As a patient, I decided to just randomly start picking a few studies to look at. And these, truly, I picked at random. And the first one is a phase 2 study of Katrina in advanced HCC. And I picked this study as the patient because I've heard of Katrina. I've seen commercials on TV about it, so it must be good. And because I don't want to get my hopes up, I understand what inclusion and exclusion criteria is, so I go straight to the exclusion criteria. And I start reading all of these bullet points. So major surgical procedure, well, major is not defined, so I don't know what that means. Prior therapy with an anti-PD-1, anti-PD-L1, well, I don't know what that means. Oh, I haven't received a vaccine, that's good. And then it says known history or any evidence of active, non-infectious, pneumonitis, I think that's pneumonia. Well, now we have a problem because I have a personal history of pneumonia, so does that mean that I don't qualify for this study? So between all this exclusion criteria and the bullet points and not really understanding everything, I am very discouraged. So now I'm going to pick another trial. And this trial is a phase 3 randomized open label study comparing Pexivec followed by sorafenib versus sorafenib in patients with advanced HCC without prior systemic therapy. And as a patient, I picked this trial because I've heard of sorafenib, and Pexivec just sounds like a really cool name. And I'm looking at the exclusion criteria. And the first bullet point says, histological diagnosis of cholangiocarcinoma, hepatocholangiocarcinoma, fibrolamellar carcinoma, and hepatoblastoma. Well, those sound like other types of cancer to me, but I don't have that, so I'm good. I'm just an HCC patient. And there's also symptomatic cardiovascular disease or current or past history. Well, that runs on my dad's side of the family, but I definitely don't have that. And then it says history of moderate or severe ascites. I'm like, well, I'm not sure what that means. And then it says bulky disease patients. I have no idea what that means. And then the very last bullet point says, additional exclusion criteria exist. As much as I didn't like all the bullet points in the other study, I'm very bothered by that last statement, because now you're losing my trust. There's a lack of transparency. And to step outside of my role as an HCC patient for a moment, I have a very personal example. I was getting ready to enroll in a trial for uterine fibroids, sponsored by UAB. I had gone through all the hoops, and at the last minute they said, oh, we forgot about this exclusion criteria we have. You don't qualify, because I had Graves' disease in my 20s. So they wasted my time and their time with numerous emails and phone calls and screening because they were not transparent about their exclusion criteria from the very beginning. And time is one of our most valuable assets, especially when you're diagnosed with advanced HCC. So we cannot rob people of their time. Now I'm going back to being a patient, and because in this study they were not transparent, I'm going to pick another trial. And this says randomized, double-blind, placebo-controlled. As a patient, the placebo part makes me nervous, but I still like it. Phase 3 study of raviserumab and best supportive care versus placebo and second-line treatment in patients, da-da-da. And I chose this study because it says alpha-theta protein. And as a patient, I do know what that means, and I know mine is elevated, so I'm thinking it's possible I might be a good candidate for this study. So once again, I just go straight to the exclusion criteria and start reading it. And the first one says, fibrolamellar carcinoma or mixed hepatocellular cholangiocarcinoma. And I know I don't have that. There's also a bullet point that reads, previous brain metastases. Well, as far as I know, I don't have that. There's another bullet point that says ongoing or recent hepatorenal syndrome. Well, I don't know what that means, so I don't know if I have it. I have not had a liver transplant. There's also a bullet point that reads hepatic local regional therapy. Well, I've had a lot of treatment at this point, but I don't even know what that means. Uncontrolled hypertension, I do know what that means. And there are so many bullet points to this exclusion criteria, I could not fit it on one slide. It's on 2 slides, so this is the second part of the exclusion criteria for this particular study. And terminology becomes a problem with all these studies. It's really difficult for patients to sit through all this information. So while there are 25 bullet points, they're completely transparent, not counting the sub-bullet points of exclusion criteria, there's some missing content on all of these studies. Patients want to know the logistics of the study, especially the cost. So who's going to pay for it? Patients need to understand the purpose of the study. Now, I know that that's in there, but it's really not in there in a way patients can understand it. Too many times patients get drugs and assume they're curative when they're not. A lot of times patients hear the word progress and they interpret that in a very different way. Patients want to know the side effects of drugs. Is the short-term sacrifice worth it in the long run? And ultimately, only they can make that decision. So now I'm no longer the HCC patient, and I just want to continue to talk about side effects. Last week, I spoke to a 45-year-old breast cancer survivor. She was diagnosed at the age of 33. She carries the BRCA gene, and she is still bitter about the treatment that saved her life 12 years ago. In fact, that's the reason she became a patient advocate. And we didn't get too deep into the conversation, but it sounded like to me that the treatment was not fully explained to her, so she could not mentally prepare herself for the side effects. And this is a direct quote from her. When did exploding diarrhea become acceptable? And when it comes to side effects, we also have to figure out and ask the patients, what about their deal breakers? This is the last photo of my sister. It was taken about a month before she died. And her first oncologist was very transparent and said from the beginning what the side effects of her chemo would be. And when my sister heard that cisplatin might cause hearing loss, she said, I would rather be dead than deaf. She was a budding musician and music was her whole life. So she drew a hard line in the sand. And if you think I could have overridden her as a parent, you are wrong. It wasn't possible. But she did agree to try the cisplatin. After 2 rounds of the cisplatin, sure enough, there was slight hearing loss, and she said, I'm done. Either find another drug, or we're not doing chemo anymore. So we found another drug. That was a deal breaker for her. I believe to improve overall participation in clinical trials, we have to increase awareness in community cancer centers. We have to involve patient advocates in trial design from day one. We really need to limit the number of exclusion criteria points, not only to increase participation and broaden that eligibility, but also to avoid the appearance of manipulation for specific positive results and endpoints. At ASCO, I heard some people grumbling about a recent HCC study that was positive. They were saying that the reason the study was positive was because only good patients were in the study. There was so much exclusion criteria that the only people who qualified for the study were patients that were, quote, good. And you don't want your colleagues or anyone else to be thinking that. We have to eliminate the financial burden on patients by having clinical trial sponsors cover all costs, whether it's industry or government. Cover the cost of the drugs, travel, accommodations, everything. We have to be transparent about everything. And we have to explain the possible side effects in clinical trial protocols in layman's terms. So I just want to close with, remember this. The average American adult reads at a 7th grade level. And more than 30 million adults in the U.S. cannot read, write, or do basic math above a 3rd grade level. And would anyone like to guess the average reading level for the 3 studies I presented? Anyone? Take a guess. This is casual participation. I'm going to make Anthony take a guess. Huh?
6th grade.
For the trials I presented. Yeah, the average level is 14.2, which means it's someone who would have completed 2 years of college. Now, it doesn't mean that you had to have completed 2 years of college, but it does mean that the text is written at that level. And one of the best pieces of advice I've ever been given was, don't treat people the way you want to be treated. You know, we're always told to do that. Instead, treat people the way they want to be treated. And I interpret that when it comes to clinical trials, we need to write and speak at the patient's level. And I'm under 15 minutes. I'm proud of myself. Thank you.